Hi everyone, my name is Colton. I'm one of the orthopedic surgeons at Premier Orthopaedics here in Broomall, and I'm here to talk about different orthopedic topics based on our new stay-at-home restrictions. Just an FYI, we are seeing patients here in our Broomall office. We have a walk-in urgent type of care every Monday and Thursday from 7:30 to 8:30 we see patients. The doors open at 7 o'clock, so if anyone has anything that they urgently need to see an orthopedic surgeon for, we have our walk-in clinic on Mondays and Thursdays. Our address here at Broomall is 2004 Sproul Road in Broomall, so welcome everybody. Okay, so we have a couple people tuning in. So we'll wait for a few more people to come in. But again, my name is Colton, and I'm an orthopedic surgeon here at Premier in Broomall. We're here on the corner of Sproul Road and Paxton Hallam Road. What we're talking about today is any type of orthopedic question you might have for me. Please feel free to enter any questions. But just to get started, I just wanted to emphasize that we are seeing patients here in our Broomall office, and we are able to see people via telemedicine, which in the comfort of your own home, you can do via a phone or a laptop computer. And we also are seeing patients in our walk-in urgent care on Mondays and Thursdays. The doors open at 7 a.m. No appointment is necessary. And you can come in between 7:30 and 8:30, and we have an x-ray here and orthopedic surgeons here to see you for your musculoskeletal needs. At any rate, now that we're here at home, I'm here in the office, but while you're at home, one thing we can talk about is how to stay safe when you're at home. One of the things we can talk about is how to keep your kids safe at home. With everybody staying at home, we know they're out biking and outside. And what I would like to tell you is, number one, we've seen an uptick in injuries with trampolines, so let's talk about trampoline safety. While I'm not an advocate of a trampoline at all, there are some things to remember if you do choose to do that for your kids. No children under the age of 5 should ever be on a trampoline, and only one jumper at a time, because kids under the age of 5 can certainly break a bone just by jumping, and most cervical spine injuries and any type of injuries occur when 2 or more people are jumping. Other things, obviously, we want kids to be wearing helmets when they're biking and wearing the proper knee and elbow pads and helmets when they're inline skating. Now that our pools are getting opened up, we also want to make sure that there's also some swim safety. We want to make sure you always know where you're diving. For those people who are taking care of their homes, let's talk about lawnmower safety. Lawnmower safety is extremely important. You never want to reach underneath the mower to fix it. In order to protect your hands, you always want to wear proper footwear when you're mowing the lawn, and you always want to make sure your kids are nowhere near you when you're mowing the lawn. So that's important to know. What else can we talk about? Now that we're spending so much time inside of our homes, let's talk about how to prevent falls for all of the older people as well as even younger people. Let's make sure we clean up our cluttered areas so there's no tripping hazards. Let's make sure the throw carpets and throw rugs are tacked down so that they're not edges where someone can trip over. Let's make sure that there's adequate lighting during the night and when it's dark out. Make sure there's handrails getting in and out of a slippery tub. Make sure that there's not a place that you can slip and fall. Continue to do things to help improve balance. Those are really important. So I'm here to answer any type of questions if you'd like. Happy to hear from anybody, as we are certainly, everybody's cooped up right now, but hopefully you can maintain fitness and flexibility. That's really important. Again, let me reiterate, we're here in Broomall. We are seeing telemedicine patients. We are seeing people on a walk-in basis on Mondays and Thursdays. The doors open at 7. If you need to come in for any type of orthopedic injury, we have x-ray here on site. We've been wiping down all the rooms in between patients. We wear masks, gloves, anything. We want to protect our patients, our staff, and by far we've been doing many more telemedicine visits than in-person visits, which is great, and I think our patients have really responded well to that. Again, feel free to give our office a call if anything is urgent. We can certainly see patients every single day. We're open Monday through Friday. What else can we talk about? How do we stay in shape? Activities where you can maintain social distancing include things like running, biking, hiking on trails, but making sure you're maintaining social distance. You can do online videos. There, I have a question about a brace. So someone was supposed to get a brace last month, but wasn't able to. We certainly, we are fitting people for braces here in the Broomall office. So we'd be happy to hear from you. You can call our number at 610-353-0800 and can contact our brace person. He will be able to remeasure your daughter, and hopefully we can get a brace that's better fitting for her. Everyone knows as early teens, girls can be growing pretty quickly at that point. So when you feel that you can just give our office a call and you can talk about when it would be safe for her to come in and get remeasured. Another question is about PRP. PRP is a newer technique that we've been using to help people with certain pathologies like tendonitis and arthritis. PRP stands for platelet-rich plasma. It is a technique we are doing here in the office. What it means is that we are taking your own blood, just like an IV stick, and taking a little bit of your blood, about 15 cc's, and we spin it in a centrifuge, which separates it into the blood and the plasma. We discard the blood and keep the plasma. What the plasma is now is it's hyperconcentrated platelets. And platelets are those things that have all the growth factors that help with healing, repair, anti-inflammatory, and all kinds of things like that. So what we do in things like Achilles tendonitis and tennis elbow, which is an elbow tendonitis, rotator cuff tendonitis, patellar tendonitis, quadriceps tendonitis, all those types of things can be very problematic. And what we do is we inject those sites with this platelet-rich plasma in a small in-office procedure that takes less than 5 minutes. And we rest that tendon and allow it to heal. And we've seen some really great results here. We've actually been also using it in people with arthritis, people who aren't quite ready for knee replacement surgery or meniscal surgery, and especially in this time where our elective surgeries are postponed or held back till the summertime. It's a really good way to help people with their pain control during this time when we're not really able to do surgery for things like rotator cuff repairs and meniscal surgeries and knee replacements. And we've been using that technique to really give people pain relief and has been pretty effective as an anti-inflammatory. Other things that we can do in the office, if need be, are cortisone injections. We've been doing viscose supplementation and gel injections for people with knee arthritis. So all of those things can kind of help keep you going while we are sort of waiting to get back into helping people surgically. But certainly these things like PRP and other types of injections can really help people's pain levels during this time. So welcome to the other people that are weighing in. Feel free to ask any questions. We're talking, again, my name is Ann Colton. I'm one of the orthopedic surgeons here at Premier Orthopaedics in Broomall. Just to let you know, we do have a walk-in clinic here for in-person visits on Mondays and Thursdays. Doors open at 7 o'clock. And we start seeing patients from 7:30 to 8:30. No appointment is necessary. We have an x-ray on site. And happy to see you if you need to. Otherwise, you can call our office. We've been doing quite a bit of telehealth visits as well, which can be either video or by phone, depending on the technology you have in your home. Another question came in about how long does a knee replacement last? Actually, it's a great question. Knee replacements are one of the best surgeries to help alleviate the pain and disability associated with knee arthritis. Most patients can get at least 20 years of lasting relief from a knee replacement. I would say the results are about 90%, which is great. We have another question. What other social distancing exercises can we do from home? Great question. So running is really easy, but it's not for everybody. So if you have access to hiking trails or walking trails, you can certainly maintain social distancing on those and do some hiking. If you want to walk at a pretty good clip, that can also be very helpful for you. Biking is also a great thing. So if you have a bicycle, is one thing that you can certainly do. Right now, there is plenty of videos online that are free and offer low impact, high impact, any type of impact exercise, body weight exercises that you can use. Of course, you want to make sure that you're healthy enough to do exercise. And if you're fit enough, then you want to start slow, kind of see how your body is feeling, and move on with that. Let's see here. It's really important that you do light weightlifting. It's really helpful to keep your bones strong to do weightlifting. And you can use things like it's always asking about man-to-man defense. Always man-to-man defense in youth basketball. Thanks for that question, Mr. Travers. I am also a youth basketball coach. I've been coaching my second grade boys in basketball, which has been really fun, as I was a former basketball player in college. And I take the coaching very seriously and hoping to get kids back in their sports. And so that's another thing that you can do is if you have a basketball hoop outside, you certainly can play. But obviously it's hard. There's not any places to go on a playground to play basketball, but hopefully you can kind of at least do dribbling exercises. So that's not a bad thing. Is if you have a basketball, you can just go outside and work on your dribbling skills if you don't have a hoop. Again, back to the weightlifting. If you don't have weights at home, you can use everyday things to do so, like gallons of milk, those kind of things. And again, I've done lots of research on home exercise programs that you can do online, and there are plenty of those, which is great. And most people have gyms that are providing online classes and things like that that can be really helpful. Anybody else have any other questions? Another thing we can talk about is stretching. Stretching is really a great thing. For those of you who are not interested in yoga, stretching can really help maintain flexibility when you're doing heavier activities. It's really important so that you don't have injuries. Stretching exercises can be found online. Also, if you come to our office or call our office, we certainly can email you exercises or send them to you in the mail. Another question about ankle replacement. Ankle replacement is one of those things that hasn't quite gotten as advanced as knee replacement and hip and shoulder replacement surgeries at this time. It is really a great surgery for very well-defined patient populations, so it's not for everybody, and it's not. It is really in a very small part of the population, but it can be very durable. It can be very useful in people who have ankle arthritis. And there are advances happening all the time with ankle replacements. But again, we have one of my partners, Dr. Paul Hornstein, is a foot and ankle expert, Harvard trained, and he would be best at deciding whether or not you're a candidate for an ankle replacement. Any other questions? Again, just want to let you know, my name is Colton. I'm one of the orthopedic surgeons here at Premier Orthopaedics here in Broomall. We see patients every day of the week. Happy to see you in person if need be, or we can set up a telemedicine visit, which we've been doing quite frequently now with the stay-at-home. Great question. An online resources for stretching and exercises. The American Academy of Orthopaedic Surgeons, the AAOS website, has some great patient education, as well as the American Association for Sports Medicine, the AAOSM. They can also be places that you can find really good patient-centered activities and education. So AAOS.org, I believe, is one of the best places I think that you can go for information regarding musculoskeletal care and exercises that are safe. Great question, thanks. The AAOS is actually it's the American Academy of Orthopaedic Surgeons, so I think there's 100,000 members. So it is one of those sites that I think that us as orthopedic surgeons use for our education, but it also has a very good patient-oriented website there. Great question. So another question about exercising, what precautions should I take to prevent injuries? So actually it's really important not to just, go from what I call 0 to 60 in 5 seconds. If you're starting a new exercise regimen, obviously check with your primary care doctor that you're healthy enough to exercise, and once that's okay, you want to start slow. So doing an activity that you really enjoy is really helpful. So in order to prevent injury, you don't want to do too much too soon. So what you can do is make sure you can, stretching first, and then once you get started with an exercise regimen, making sure that you're monitoring yourself for any pain. If pain is persistent, despite ordinary things like taking anti-inflammatory medications like Advil, Aleve, Motrin, and icing, if things persist, that's when you call one of us, and we can certainly help walk you through any type of injury that might occur. Good question about baseball. So baseball is one of the more chronic injury prone sports. We've been talking about pitching, and I think the biggest thing in youth baseball is pitch counts, and maintaining the amount of pitches per week is really important. I can't emphasize that enough. It helps reduce the risk of injury to a young person's body, to their shoulders, to their elbows. And so that's really important. And then a curveball is a very technically advanced pitch, and it should really be only reserved for kids as they're moving into late adolescence, into sort of mid to late adolescence. Thanks for that question. At any rate, again, one more time, I just want to let you know, I'm Ann Colton. I'm one of the orthopedic surgeons here at Premier. Hope that this was helpful for you. And if there's anything I can do, to help, please don't hesitate to contact our office. We're always willing to help any way we can. And is there any final questions before we get moving on? All right. Well, again, thank you all for tuning in, and enjoy the rest of your day. Everyone, please stay safe, practice social distancing, and we'll see you hopefully if you need us. Take care.